Tamara Elsie, and I will start with my head-to-toe assessment. First, I will check the orientation of my patient. I'm going to ask person, place, and time. I'll do this by asking my participant's name.
Demetrius Morgan.
And what type of building are you in right now?
Apartment.
Good. And where is this apartment located?
Collierville, Tennessee.
Good. And what year is it?
2015.
Here, I'm just checking for orientation to begin my assessment. The next thing I'll check is his head. I'll check for any masses, any asymmetrical, any soft spots, anything like that, and he has none. The next, I will start with my cranial nerves. Cranial nerve 5, which is just your ocular, your tegmental, which is your corneal reflexes, any facial sensations, and jaw movements. Here, I'm going to ask my participant just to close his eyes. Which side of your face I'm touching? Good. And which side of your face am I touching? Good. And any of my touches feel rougher than the other side, or are they both the same?
Same.
Good. And there I'm just testing for sensation. The next cranial nerve I'll test for is 7, which is your facial movement. I'll get my participant to raise his eyebrows up and down at the same time. Good. Puff your cheeks out. Good. Can you frown for me? Good. And then smile for me. Good. And as you can see, everything is symmetric. It doesn't hurt or he doesn't grimace performing any of those exercises. The next thing I will do is have my participant show his teeth. We're checking for any just abnormalities. Stick your tongue out. Tongue is midpoint. Tongue is pink, as well as mucous membranes are pink and moist. Nothing dry, nothing cracked, no sores or anything like that. The next thing I'll do is I'll inspect his eyes. Usually with your eyes, you want to look at the pupil. His pupil size is about a 3 millimeter on both sides. We'll pull it down so you can see the sacral. Good. And also looking at eyebrows, his eyelashes and things like that. No missing eyelashes, nothing out of the norm. The next thing I'll check for is perla, people reacting to light. And here I'm going to get you to stare straight ahead. I have my little light. Good. Good. And all I'm looking for is that those pupils constrict when they come towards the light. And he did just that. The next thing I'll check for is your cranial 3, ocular motor, cranial 4, tracheal, and cranial nerve 6, your abducens. So what I'm going to do is I'm just going to cover up one eye. How many fingers am I holding?
2.
Good. How many fingers am I holding?
3.
Good. And I'm going to cover up the other eye. How many fingers am I holding?
1.
Good. How many fingers am I holding?
2.
Good. And can you follow my finger for me? Good. Good. He follows my finger. He's tracking very good. He's able to see at all levels of his visual field. And so those are all normal findings. The next thing I'll do is look at the ears. Just palpate, inspect inside. No redness, no soreness, no warmth. And those are also normal findings. A lot of times when you perform this, you'll do the whisper test, whisper something, whisper a sentence, and get that participant to repeat what you said. The next thing I will look for is the nose. Nose will look for any deformities, any inflammation, any sinus drainage, or anything like that. And his is also within normal limits. You can also use your light just to check for patency. Good. Both nostrils are very patent. Very, very patent. So with that being said, I'll start with cranial 1, which is your olfactory. Could you close your eyes for me? What are you smelling?
Marker.
Good. And that olfactory is your smell cranial nerves. The next one is 9, 10, and 12, which is your glossopharyngeal and your vagus. Here, I'm going to ask my participant to repeat after me. You can't teach an old dog new tricks.
You Can't teach an old dog new tricks.
Here I'm actually listening for sound, listening for voice, hearing if any hoarseness or raspiness occurs, and none of that, all within normal findings. They're all rhythmic, they all sound good. So he is okay with that. While I have my flashlight, I will just check your plate and your mouth, just hard plate, soft plate, and just your tongue and your tonsils. A lot of times, just say out for me, you can see really good with good. Everything within normal limits, no sores, no bumps, no bruising in any of those areas. The next thing I will do is just palpate your trachea. Ask you to lean forward just a little bit, good, and move my finger towards the right a little bit. And there you can feel is no enlargement. It is movable, and that is normal for that trachea to be like that. The next thing I'm going to get you to do is your spinal accessory nerve, which is 11. Ask you to shrug your shoulders, and I'm just going to pull a little force behind it. There, I'm checking for symmetry. I'm checking for strength as well, and normal findings as well. The next thing is your cervical lymph nodes, which your cervical lymph nodes is not supposed to be tender, they're not supposed to be enlarged, and they're supposed to be movable. You have 10 of those. Those 10 are your preocular, postocular, occipital, tonsillar, submandibular, as well as your submental, superficial cervical, posterior cervical, deep cervical chain, and supraclavicular. The next thing I'm going to do is normally I would have my mallet with me, and I would check for reflexes. Checking for your patellar reflex, which is the most known, is right here. My mallet is loosely between my thumb and my index finger, and right there is where I would hit. The next would be brachial. You want to go 2 inches away from the wrist with your mallet, again, loosely between your thumb and your index finger. And that's where you would hit. And that concludes my head to toe assessment. Thank you.